Joseph Ricotta, National Medical Director of Vascular Surgery and Endovascular Therapy for Tenet Healthcare, and Professor of Surgery and Program Director of the Vascular Surgery Fellowship at the Florida Atlantic University School of Medicine. One of my passions is medical education and training the future surgeons and vascular surgeons. I've trained at some of the best academic institutions in the world, and when I came to Florida to start this fellowship program, my idea was to take the best of those experiences and combine them with the best of being in a very busy, large volume, quaternary care community hospital. The fellows get exposed to everything that you could get exposed to at the busiest and best academic medical centers in the United States, with all of the clinical exposure and the wide variety and the depth and the breadth of complex and simple cases that you can do in vascular surgery, as well as this real-world experience both in the outpatient and in the inpatient setting.
Unlike many of the other fellowship programs across the country, this program offers excellent surgical training, both open and endovascular, and really their training will cover a wide breadth of vascular pathologies. They also will have access to the most cutting-edge technologies, the newest devices, and also couple that with being involved in research programs.
I've seen fellows do research on pulmonary embolism, where there's been significant change in even some of the literature points and management of some of those patients due to the large volume of patients we've seen with pulmonary embolism come through here.
I think that's a strong suit of this fellowship program here at FAU is, again, not only the breadth of cases, but also the sheer volume of cases. The second-year fellow will be doing anywhere between 5 and 10 major vascular surgeries a day, which is pretty unheard of across the country with regards to other fellowship programs.
There's nothing that we don't do here that they do at other large academic medical centers that I've been at previously or across the United States. We're involved in all of the latest clinical research trials. We have access to all the newest technologies. We are pioneers in the field. We did the first endovascular robotics procedure in the United States here at Delray Medical Center in 2018. We did the first TCAR in Florida in 2018. We set up the first pulmonary embolism program in Palm Beach County. And so we have a lot of firsts, adopting new technology and pushing the field forward.
I've been practicing vascular surgery since 1980, and I've served as the chairman of the Vascular Surgery Board for the American Board of Surgery, as well as the director of the Residency Review Committee for Surgery. One of the things that strikes me the most about this is the level of institutional commitment to vascular surgery. They've invested a lot of time and effort in the development of this program. It's been very successful. And clearly, vascular surgery is well recognized within the institution and well thought of and well supported, which is extremely important for an educational program.
Here at Delray Medical Center with FAU, vascular surgery is second to no one. So that's something I have not seen anywhere else, that we have those abundance of resources, because hospital and administration is on board with our mission, and that's to provide timely care, excellent care to our patients.
I knew right away when I went into medical school I wanted to become a surgeon, specifically vascular surgery, just the different technologies that we use, the different modalities we're able to use to treat our patients, both endovascular and open. I knew that this training program would expose me to a wide breadth of vascular surgery, and they practice evidence-based medicine to provide the best care for our patients. I knew that I'd get exposed to both open and endovascular techniques using the most up-to-date technology. One of the big things I was looking for in a fellowship.
When I was searching for a program as well, a big concern with the advancement of endovascular surgery, a lot of opportunities are missed for open procedures. That's not a concern here. We get them all the time.
You bring in that academic prowess, a background that Dr. Ricotta has, and that community aspect, and you have an excellent academic hybrid program that we find ourselves in. So that's something I was looking for in my search for our fellowship program that was comprehensive as it is now.
We also have this philosophy of progressive autonomy. So as the fellows demonstrate their competency and their comfort level with cases, they are allowed to do more and more independently.
When they come here, they don't know endovascular surgery, they don't know all the unique fine points and tenets of vascular surgery, and there's a lot that they learn over a very quick period of time, and it's pretty rewarding to see how they grow.
One of the biggest problems in surgical training now is that many of the residents don't actually do major portions of the cases until very late in their training, and sometimes they never actually do a complete case before they graduate.
I feel like you are the surgeon and he's there to guide you. So you have to come in prepared. You have to know what you're doing. It's a lot of autonomy. With Dr. Okada advising and stepping in on critical aspects of the procedure, but you're there and you're guiding the surgery, you're leading, you are the surgeon in those procedures.
There's no question that when our fellows finish their 2 years here, they're equipped with any skill set to handle any vascular problem in any situation on day one. They don't need any extra training because of the depth and the breadth of exposure to clinical cases that they get here.
Any fellow that comes through this program will be extremely prepared for real-world practice and be able to tackle any vascular problem that they might encounter in their first couple of years out of training.
You will come out prepared to do vascular surgery, no doubt about that.
Our goal is to train excellent, outstanding vascular surgeons, not average, but excellent, outstanding vascular surgeons that are going to push the field forward in the next 20 to 30 to 40 years.
So really in this fellowship, there's nothing that we don't cover. And learning from the staff here and Dr. Okada, I have no doubt that I'll be a successful vascular surgeon. When I'm out in the field of vascular surgery, I'm gonna be fully independent. I know that I could be the only surgeon for that patient and I could take care of that patient.
There's no doubt in my mind that once I complete my fellowship training here at FAU Delray Medical Center, I will be a surgeon that can tackle any case, any challenge that comes my way. Some of the cases that I've seen here are cases that you could not see elsewhere nationwide. So you want to be part of something this grand. You want to have that confidence leaving a training program. And that's Dr. Okada's vision for his fellows and any future fellows that are interested in becoming part of this team.
For the fellows that are coming in, I'd say be ready to work hard. This is a great place to train because of the exposure to everything. You're going to learn a lot, not just about operating, but the art of vascular surgery in general and taking care of these types of patients.
So I think that Dr. Okada is a great role model for what I want to be as a vascular surgeon. Care that he provides for his patients and the level of detail that he works in is really an inspiration for me. He's actually the reason why I went to vascular surgery in the first place, rotating with him in the service. Originally I didn't really know what I wanted to do. But rotating here as a general surgery resident, I was able to see all the amazing stuff that he does here, and that kind of led me into vascular surgery.
Just seeing their growth over the 2-year fellowship program is incredibly rewarding. Seeing them develop not only clinically, but also becoming confident vascular surgeons over the course of their 2 years here.
I think that the program that's been set up here is broad in nature, deep in terms of experience, and allows the residents to get the richest possible experience that they can get.
To see them, finish an operation that they've pretty much done on their own from start to finish, and you can see that level of confidence and comfort level in their eyes that they know that they can handle this, that they know that they're ready to go out into practice, is incredibly rewarding for me personally. Yes, they're involved in research, and yes, we have conferences and tests, and they read textbooks, but we teach them how to set up a practice when they get out there in the real world, how to set up a vascular laboratory. So this sort of real world, practical education we emphasize to our fellows so they're comfortable being in any setting, an academic setting, a hybrid model, a group setting, a solo private practice setting, and they have all the necessary skill sets to be successful in any and all of those settings.